Well, good afternoon, everybody. Thank you for coming. I really appreciate you being here to talk about something so important to this country. This is yet another afternoon when more than half of the American population are living as second-class citizens, stripped of their constitutional right to privacy and basic liberty. I want to thank all of the advocates that are standing here with me. I want to thank Gillibrand, who's on her way, President Andrea Miller of the National Institute of Reproductive Health, Ann Davis, our Associate Chief Medical Officer for Planned Parenthood of Greater New York, Dr. Stephanie Rand, Dr. Bianca Hall, and all of you who are here to be heard. It really does matter. I also want to recognize Rose Pierre-Louis, Executive Director of NYU's McSilver Institute, for her advocacy and her leadership. In a radical, extremist, unprecedented decision last week, the United States Supreme Court stripped more than half of the population of their basic human rights. It utterly ignored 5 amendments to the Constitution that enshrined the fundamental right to privacy, to make your own decisions about your life, your liberty, and your private life. They turned the clock back nearly 50 years, rescinding for the first time a constitutional right that had been granted to half of Americans. This decision could leave as many as 36 million people in 26 states without comprehensive reproductive health care. It's unconscionable and it's an outrage. I can tell you that the fallout of this decision will be catastrophic for generations. Because of our country's legacy of racism and discrimination, the consequences will fall largely on people of color who already face the greatest barriers of healthcare, including Black, Latino, and Indigenous communities, people with low incomes, LGBTQ+ people, immigrants, and people living in rural areas. The U.S. is the only industrialized country in the world where maternal mortality is actually rising. And the U.S. has the highest maternal mortality rate among any high-income country.
Yes, it does.
Each year, about 700 American women die during pregnancy, childbirth, or from subsequent complications. If you're a Black woman in America, you are 4 times more likely to die in childbirth or within a year of giving birth. If you live in a state that is certain or likely to ban the access to reproductive health care, the maternal mortality rate is nearly 50% higher than the national average.
That's right.
Let that sink in. If you live in one of these states, the maternal mortality rate is 50% higher than the national average. So when the Constitution says they guarantee life and liberty to all American citizens, this Supreme Court is not including you. They're not including women all across this country, denying those basic constitutional freedoms.
No, they're not.
And given how this decision treats court precedent, the right to same-sex marriage, the right to contraception, the right to personal decision-making or liberty could be at risk as well. So we have to keep fighting. We have to keep promising we will leave no stone unturned. I've been reaching out to my Republican Senate colleagues, urging them to support universal paid leave, increased access to affordable health, access to increased affordable child care, and increased availability to prenatal and postnatal care so that people have the resources they're going to need in this post-Roe world.
That's right.
And my staff are pulling out all the stops that we can, trying to find ways that we can pass laws to counteract this unconscionable decision.
Bravo.
So one issue we're looking into right now is how we can protect our personal data. I have a bill called the Data Protection Act, which basically codifies a right to privacy and defines what a privacy harm is in this country. That bill alone could help protect the millions of women who are now at risk for their state governments to trace them, track them, and try to prosecute them for crossing state lines to get access to health care or to get mail order contraception or mail order reproductive care. We're also going to work with other senators who have legislation called My Body, My Data Act that Senator Hirono has written that would protect the privacy of personal reproductive or sexual health information by minimizing the collection, retention, use, or disclosure of personal reproductive or sexual health information. We're also working on legislation to reiterate the constitutional right every human has in this country to cross state lines.
That's right.
It is a constitutional right.
That's right.
And it is an outrage that this Supreme Court and that the Republican leaders in this country have said they somehow want to abrogate that right as well. These are things that we want to do to begin to protect these rights and freedoms. But the most important thing that we can do is be advocates. The most important thing that each one of us can do is to raise our voices to be heard about how we feel about this issue, how it will affect us, and what we want as American citizens. This is a time when you should not be shy about your feelings or your beliefs. Share them with every family member. Share them with every man in your life about why they should care about these constitutional freedoms too. Make sure no person doesn't understand where you stand. So please amplify your voices and do not give up. We also have to know our rights. And there's a lot of organizations out there that are trying to make sure people are not uninformed. You can go to reproductiverights.gov. It's a website where it outlines every right you have and where you live and what you can do. Second, make sure everyone you know is aware of Planned Parenthood and everything that they can do to support that organization to meet the care needs that people have across this country. And third, there are ways you can protect your own personal data. And those are available by the Digital Defense Fund, have guidelines. But in short, here's a few guidelines. Review the privacy practices of every app collection in your health data, especially period tracking apps. Make sure to send a data deletion request if that's available. Browse the internet securely, either by going on incognito mode or by using VPNs or private browsers like Tor. Turn off location tracking and mobile ad IDs. Use an encryption chat app like Signal or Wire and turn on disappearing messages. Protect your devices by setting strong pins or passwords on your phone or laptop and double verification. By the end of the day, the cold hard truth is what we need to do, which is to win elections. And I know people get frustrated because they say we have a Democratic majority in the House and the Senate and the White House, but we don't have enough votes. We don't have enough votes to abrogate the filibuster. We don't have enough votes to get this done by just Democrats, and there are simply not enough Republicans who care at all. There's probably two. And when you only have two Republicans, you cannot get to 60 votes, no matter how much you compromise, no matter how minimized you make this right to privacy and this right to reproductive care. If you don't have 60 votes, you can guarantee nothing. And if you don't have 50 Democrats who want to abrogate or amend the filibuster, you can't codify Roe. And those are just the cold hard facts. So it's all about changing how people feel in this moment. Any person that you know who is sitting on the sidelines, any person you know who said my tax rate's more important than anything else, this is when you challenge them. This is when you talk to them and tell them what it feels like to be less than a full citizen. Tell them what it feels like to not have that right to privacy that's been guaranteed for 50 years. Tell them what it's like to not have bodily autonomy and that you actually could not make a life and death decision about yourself. Tell them how that feels and how it feels to not have those full rights of civil liberties and civil rights and citizenship. It's not acceptable. So please be heard. This is your moment to be heard.